So, hello everyone. Thank you for joining us for this panel called Digital Platforms for Health and Inclusive Growth. I'm really excited for this panel. We've got some amazing speakers and we're joined by a wonderful moderator. I'll hand over to now, Samiso. So thank you very much.
Thank you. I think we're all really excited to be here, whether it's morning or afternoon, wherever we are. So thanks to everyone for signing up and for joining us on what I'm sure is going to be a very interesting discussion. Healthcare, particularly healthcare provision in Africa, has really come to the forefront in the aftermath of the COVID-19 pandemic. I think a lot of us throughout the African continent saw that the resilience of our healthcare infrastructures was really tested throughout the pandemic, as well as noticing the socioeconomic impact that was resultant from poor healthcare infrastructure systems. I'm joined today with a number of esteemed panelists who will share their views and perspectives about the role that digital technologies can play in innovation in the healthcare sector. I'll start off by very briefly introducing the panelists. We're joined by Simbo Bella Okui. She's the MD and CEO of Avon Healthcare, which is the leading Nigerian healthcare management system organization in the country. We are also joined by Jean Filbert Nsengimana, who is the Chief Digital Advisor at the African CDC, which I'm sure a lot of us didn't know was even a thing until quite recently. So I look forward to picking his brain about what's happening there. He also serves as an advisor to the Commons Project, which is a people-centered digital health ecosystem in Africa. And we also have Dr. Amit Thakur, who is joining us, and he is an entrepreneur and a philanthropist and an innovator who works with a large range of actors. These are governments, private sector, as well as non-governmental organizations that are really focused on implementing private-public partnerships with healthcare objectives. We are also joined by Dr. Ekong, who is a public health pediatrician who also serves as Deputy Director of eHealth at the Department of Health Planning, Research and Statistics. Welcome to all the panelists.
Thank you.
Great. So we're gonna jump right in, and I'm sure a lot of really interesting discussion has come up in throughout the rest of the summit. But really, the focus right now is on healthcare, and diving right in with potentially quite a tricky question is, despite the awareness that African governments have about the importance of developing and maintaining robust healthcare systems, why are there still some stumbling blocks? Why are we still struggling so much? And why are so many healthcare systems still underfunded? We'll maybe start with Simbo. Your thoughts?
Yeah, thank you very much. I mean, we do say it's underfunded, and that's not false. But I mean, I think we should also recognize that there has been increased funding over the years. In 2016, for instance, the federal government of Nigeria invested about 700 million, equivalent of about $700 million in healthcare. In 2022, they budgeted to spend over 2.1 billion equivalent in dollars. So there is increase in funding happening. I mean, COVID-19 was a part of that because it did throw up many gaps in the system. And, every government in Africa has kind of made a concerted effort to invest more in their healthcare systems. In Africa, there are many areas in which development is needed, infrastructure for industry, you have education. So there are quite a lot of other issues that demand for funding. But the good news is that, the funding is increasing quite substantially. It has tripled in Nigeria over the past, since 2016 and now, like I said. So I think we're getting there.
Okay. On that, and if I can ask a very quick follow-up question, taking your words into account, is the issue then not funding, but more about the efficient use of the funds that are designated for healthcare?
Definitely. I mean, right now, according to data, over 70% of healthcare is still paid for by out-of-pocket payments in Nigeria. I think across Africa it's probably about 50%. That's very, very inefficient. There's an ongoing, very, very, concerted effort in advocacy in Nigeria to push for legislation that will make health insurance compulsory, thereby creating a really large pool, to enable people have financial access to healthcare services. So part of it is that. It's that when there is no real progress made in the area of universal health coverage, there will be struggle when it relates to funding for healthcare services.
Thank you. Amit, I'm interested in your interventions at this point, because you sit at a very interesting juncture between governments, private sector, development of financial institutions. How are you seeing it from your vantage point?
Right. I think I agree with the previous panelists talking about funding, but I want to put a different spin that we don't need only more money for health, but we also need more health for the money. If we actually effectively utilize the existing funding, we would produce double the health than we're producing. The systems would be much stronger and tighter. The amount of inefficiencies in all our African health systems is actually directly impacting health indicators across the world, across the continent. So I fully agree that we need more funding, but we also need to work better with the existing funding. We also need stronger leadership. I think we've had weak leadership that we've seen has been changing dramatically over the last decade. I'm really happy with the new leaders in some of the countries. But there are many countries where leadership is extremely weak in the public sector and in the private sector, which makes the systems work so inefficiently. If you look at supply chain, even during the pandemic, we were so clear which countries struggled the most and which countries picked up very quickly. If you look at simple aspects like masks and PPEs, there were some countries that were unable to protect the health workers and the frontline workers for a very long time. So it really spoke to the attention that was given in strengthening health systems in the past. So in my opinion, funding and leadership is a combination that's non-negotiable to strengthen health systems in our countries. It's very critical.
Thank you. Thank you. I'm going to go to Phil first and Inyabong afterwards. So Phil, from the macro perspective, because you're sitting in quite close proximity, you're advising the African CDC, those inefficiencies that Amit was talking about and the leadership component, how did you see that playing out from your vantage point at the African CDC, particularly as it related to the COVID-19 pandemic?
Yeah, I want to first offer my perspective, which is complementary to what Amit and my colleague gave on the funding. While I agree that there is increased funding over time and that there is a problem with optimizing the funding we have to get more health with the money we have, we also need to bring the perspective of the resource constraints that the continent is facing. Because if you look at the GDP per capita in Africa in 2019, for example, it stood at about $1,600. And while in the UK, it was $43,000, for example. Now, when you look at the per capita spending in these two places, in Africa, the per capita spending on health stood at about $80 a year per person. In UK, it was about $4,270. In US, it's even more. It's more than $10,000. So we are talking about trying to catch up on such a huge deficit in spending. And even if you would say, let's spend all our GDP on health, we couldn't even match the UK or US in terms of how much they spend. No food, no transport, nothing. Let's spend all on health. We wouldn't even match. So the question here is, we need to recognize in Africa that there is a resource constraint that we are facing, and we need to be smart about how do we utilize the few resources we have. But we shouldn't sort of blame our decision makers. And here I think I'm putting my government cap. I used to be a former government official, blaming government of not spending enough on health, because there is not enough to be spent in the first place. So that's number one. Number two, there is a resource competition that you don't see in other places. Every $1 that is available in sub-Saharan Africa There are people who would die to say, let's spend it on food, others on education, infrastructure, defense, security, and so on and so forth. But proportionally, I think it's important also to realize that UK spent more than 10% of their GDP on health, while in sub-Saharan Africa it's less than 5% of the GDP spent on healthcare. So I think the premise of this question is correct, that we still underspend on healthcare, and we should fix that. We should spend more. Even of the few resources we have, we should spend more, move from 5% to 4.5 actually today, spend on healthcare, to something closer to what even advanced economies are spending on healthcare. And then finally, I think there is this question that Amit talked about, which I really agree with, which is about optimization. And I'm here to say that while everything needs attention, I think one way we optimize dollars spent on improving and strengthening healthcare systems is digitizing, but digitizing the right way. So let me pause here.
That's great. I think you've set us up for a next round of really interesting questions. Inyobong, do you have any interventions that you'd like to round off before we move on to the next questions?
Yeah, thank you very much. I also want to agree with the previous. Basically, we all agree that health finance is at the center of challenges of the health sector in Africa. For instance, in the Abuja Declaration of 2004, countries in the African Union agreed to set of 15% of the annual budget for healthcare. But as I'm talking to you now, I'm not aware if there's any country that has achieved that agreement. And even beyond just budget, we have to look at the budget performance in these countries, because it's one thing to budget money, and then it's one the funds available for implementation of these plans. Again, I want to also bring another perspective as around the social determinants of health and the effects on the health sector in Africa. No matter what you do in the health sector, if you are not able to provide those social infrastructure and amenities, you're not gonna achieve quite a lot. If you don't have water, you don't have electricity, if there is unemployment, I mean, there's not much to what you can achieve. And most recently, the issue of brain drain has been quite disturbing. You see a lot of doctors and health workers now migrating out of Africa to Europe, and to places where you have better, level of livelihood. So these are things that are on the health sector. To see any meaningful improvement, we need to address some of these social determinants of healthcare and provide a better economy in Africa and a better standard of living for Africans.
Absolutely, it's not an issue that needs to be looked at in isolation of other factors. And I think one of the things that you mentioned, which was an important reminder to myself as well, is that when we talk about resources as they relate to the healthcare sector, we're not just talking about financial resources. We're also talking about people. I don't want to say human resources, but we're talking about the people that actually populate and that deliver the service. And there is that brain drain, which has an impact on local healthcare systems. Phil, coming back to you, because you mentioned the role that digitization can play in improving healthcare outcomes. You have been on one side, and you mentioned this, you've been on the government side of it, and now you're on the other side of it in a sense. What role do you think digitization can play in a very practical sense to improve the system, the healthcare system, but also the outcomes that governments are looking to get?
I was speaking on mute. I think that the role that technology can play in improving healthcare systems is almost the role that technology plays across all other sectors. And there is a question about how technology can be used also reach Sustainable Development Goals faster. So that role usually revolves around use technology to drive efficiencies, to get more for less, to increase speed, to sustain, and to support scaling. Then to do all of that with precision. I think if we take those 4 things, efficiencies, speed, scale, and precision, then we can start looking at use cases of technology, of use of technology that can help save lives. And I will give just one, but there are, myriads of them. In 2016, I was still in office as Minister of ICT and the Youth in the government of Rwanda, and there came a company called Zipline, which does drone logistics or instant precision logistics, and we picked delivery of blood as the use case to try this technology on. Now, 4 years later, the case is very clear. Delivering blood used to take something around 4 hours. Now today, in a case of emergency, blood can be delivered in every healthcare facility of Rwanda within 15 minutes. And if you keep in mind that 30% of all maternal deaths in Africa are due to postpartum hemorrhage. And usually when blood is needed, we know that there are constraints in terms of infrastructure, cold chain, transport, that makes it completely impossible to stock every blood product at every health center. So people need to ferry those products back and forth when there is a need. So the difference between 15 minutes and 4 hours is a huge difference between life and death. So many lives have been lost. And introducing that component of technology not only saves lives, but also takes away some of the costs. It's when deployed at scale. Now we're talking about Rwanda, Ghana, and a few states in Nigeria, soon to be in Cote d'Ivoire and other countries. That technology is really demonstrating how we can apply technology to save lives. So the other consideration I want to bring here, and is an example again from my country, Rwanda, maternal mortality in Rwanda reduced by 77% between 2000 and 2013. At the same time, and child mortality also reduced by 70%. Now, and it's really on the course to meet the 25 death per 1,000 live birth target of the SDGs. Now the question is this all due to technology? I would say no. Technology alone doesn't work. I think Amit put a very good case about that. It doesn't work. It has to go with leadership. It has to go with increased budget, of course, allocation. There is no question about that. But it has to go with good governance, fighting and eliminating corruption, strengthening primary healthcare systems, investing in human resources, even if some of them will go away. Dr. Ekong, I think, talked about the brain drain, but we shouldn't be discouraged. We should continue making investments. And I think the good governance piece is what is going to reverse the brain drain. And if I respond to the remark of my colleague, because we've seen that in many places, including my country, where the top professionals trained, even sent for training. It's not like even brain drain. I mean, these guys are sent and paid for to go and train, but they do come back. And sometimes they even bring back their friends when they feel like the environment is right. I think the sense of mission is more powerful than the comfort that some of these places offer. Thank you.
Absolutely. And I think, you mentioned quite a few things, and it made me realize that we've been, at least up until this point of the discussion, really focusing on the government's role in this. And I think it's important because, as you said, it creates that enabling environment and really sets the objectives that the whole of society should try and move towards. Simba, I'd like to bring in your perspective, because you are coming in from the private sector, from the corporate sector. And what role do you see corporates playing in this? You've talked a lot about the intersection of technology and the private sector, and how that can really catalyze things. What's your take on this?
Yeah, I mean, it's a very significant issue when you think about it. The corporate sector are both consumers of healthcare services as well as investors in healthcare services. and I can talk first about them being investors in healthcare services. The two are intertwined, really. I'm not sure that one can really separate it, because you have corporate organizations that subscribe to health plans for their workers and their families. And the first thing is that they pay the right price for it. Very often you see that corporate budgets, when they're going to be cut, they start by cutting some of this, what they term as welfare, elements of people's remuneration and of their cost. So the first thing is to encourage corporates to please try and pay a fair price. Whatever is being paid is going into strengthening the healthcare system. The second is we saw examples, during COVID-19, at the height of the crisis, how many corporate organizations came together to fund infrastructure, to fund technology, to fund many aspects of the investment that was needed to build resilience for COVID and treat and test COVID, all of that. I think that's something that should be encouraged to continue. It shouldn't just happen when we have COVID-19 pandemic. I think that corporate organizations can come together and make a concerted effort to invest in the healthcare systems of the countries in which they operate. In addition to that, I'd like to give an example of our own organization. I'm part of a larger group of companies called Hairs Holdings. And we do have a philanthropy arm, the Tony Elumelu Foundation. There's been so many health tech founders and entrepreneurs that came out of this. We have Doctora. It's a technology platform where doctors have access to utilize brick and mortar hospitals and clinic facilities across the country, and patients can also, subscribe to that. There's LifeBank, which I'm not sure, I think might be what Jean was referring to when he talked about, a technology that enables speedier delivery of blood to hospitals that need it. There, I think I can think about three of this kind of entrepreneurs that have come out of, the funding provided by Tony Elumelu Foundation. So I think corporates can do a lot more because, technology helps to deliver services at speed. Technology helps to scale, through telehealth as well. You have healthcare services being delivered to remote, hinterland parts of the country. Technology also gives a better assurance of quality. Technology and digitalization helps us to amass data. Very important. Predictive analytics is important. Now, big data is playing a huge part in healthcare systems around the world. So one can't overemphasize it. There's a lot corporates can do.
Fantastic. Amit, you know a lot better than most that it's about the private sector involvement. It's about an investment, government creating an enabling environment and contributing to that investment. But the other piece, which both Phil and Inyobong mentioned, is the motivated and qualified healthcare professionals. What do you think the situation is at the moment, and where do we need to start taking it? Do we need to reframe the way that we're thinking about recruiting and retaining and retraining healthcare professionals, or do you think we're doing a good job generally in most countries?
I think that's a good question. I would go slightly behind and to the training part for the healthcare professionals. I think we need to introduce new kind of courses that we probably haven't even employed and started even thinking of creating job descriptions in our hospitals, in our health institutions, in our manufacturing lines. We need digital health technicians. We probably need AI nurses. We need robotic engineers. We need insights from the community health workers to adopt technology. So I don't know what the terminologies exactly are. People in academia may know, but I think we need to start training our youth, not only to start picking about these technology courses in health, but to actually better than the ones being already offered. So we could be even exporting these services to the rest of the world. Now in US and UK, where we heard they're spending $4,000 and $10,000, the needs are different. Now, with our needs, when we have these youth who will be trained into the entire new ecosystem of digital health, they will be able to offer primary healthcare services with a different touch. They will be able to prepare secondary and tertiary with a different flair. When they do come into practice, they'll
I
be
think
using
we've lost Amit there briefly. He might try and reconnect. Fulbert, maybe if this is something that you can shed some light on in terms of the types of innovative roles in the medical profession that we need to start thinking about and need to start steering or training or supporting young people in developing in those careers.
Yeah, absolutely. But Amit is back. Amit, I can go just right after you if you can hear us.
Yeah, if you can hear me, I can go after you. You can go ahead, and I'll finish up on my training line of thinking. Go ahead.
I can't hear him. But...
Yeah, it's interesting because I was actually enjoying what you were saying. You know, the kind of new types of jobs that we need to think about, sort of at the intersection of healthcare delivery and technology, the role of AI, robotics. We talked about drones and so on and so forth. I think all of those are very, very interesting thing. And Amit is much more eloquent than me, so I will not try to go there. But there is another role that in my experience, I've seen. It becomes, there are very few professionals who can understand both the language of public health and technology to be able to match the challenges that we see in public health, understand them, and understand also the power of technology to help addressing those challenges. My experience is much of the innovation in the health tech space has been driven by tech guys, you know, software engineers graduating of top computer science schools, entrepreneurs, and then they go on to, you know, find a friend who's a medical doctor and so on and start thinking about these apps. But you feel like there is a limitation in understanding how public health and healthcare really works. So I think, and that deficit of people who can understand both disciplines goes up to even the policy levels. So you realize that those policies, regulations are not necessarily being driven by executives who understand both worlds. So I think one role that I've been advocating for a lot is some kind of health tech, you know, chief information officer or chief digital officer or chief data officers, but people who have either come from a tech background, but really embraced and understood public health, or vice versa. Because once those people are there, they are the ones who are even able to write those kind of job descriptions that you were talking about. Otherwise, you find digital innovation so much skewed either or you know, on the side of tech with little input from public health, or the other way around. So chief information officer who understand the business domains of you know, technology and public health is another role that is really necessary. And you need both at the policy, hospital, even at the low, you know, basic healthcare, primary healthcare, as Amit was trying to articulate.
Fantastic. I mean, welcome back. It wouldn't be a conversation about technology if technology hadn't wobbled on the call. So back to you. You were sharing with us your thoughts about the types of roles and the types of professions that really need to be integrated or adopted in the healthcare sector. So please continue.
Sure, thanks. So, you know, if we start training these youth that we have in Africa, it will also start reversing the brain drain. And we will not only employ these into our corporates and the strength of the private sector and create new jobs, but you will find that we will become a globally sought healthcare sector that will start remotely providing services to the developed world, but many of them may want to employ our chief AI health technician from Africa. And it will change the economic dynamics. Now, we are a youthful continent and we capitalize on that. But I also want to say that the private sector focus on Africa has really changed. And in some hotspot countries, about 6 or 7 countries, I think we have the biggest raw material and the potential of scaling up digital health technology and working with the governments with the enabling environment, and the pace and acceleration will move. We need the right regulatory framework, which I think some countries are working on. And through that, I believe we will solve the challenges of the primary, secondary, and tertiary healthcare system. We may not really be more interested in high-tech machinery, which are still being made by other countries. We can still work with in partnership. But I think this is one area that the pandemic has revealed that Africa can take the lead because we are ready to leapfrog and we have a youthful continent ready to explode these digital health solutions. We just need governments and private sector to work in tandem. There is absolutely no way if the innovators and money for corporates will come in, but the regulatory framework is weak and fragmented. Nobody will want to invest. But if there's work in tandem in countries like Rwanda, for example, I'll highlight that. It's amazing that the government is creating an enabling environment and it will fuel these innovations. We heard about the drones, quick to uptake. I mean, in Kenya, we spoke about it. We said, how come? I mean, they're East Africans just like us, but this competition is healthy. How come in Rwanda, blood is being transferred to mothers in such quicker way? What are we waiting for? And the government was a bit concerned about security of drones due to the border with Somalia that we have, and we needed to frame that up. So people didn't start using drone licenses to start creating insecurity in some of the towns. I'm just throwing some challenges that some countries might have. So over to you. Thanks.
Absolutely. Thank you. So I'm going to give us another 10 minutes of questions before we open it up to the floor. Hi to everyone joining us from Ethiopia. I saw from Seattle, from West Brom, and Nigeria. It's good to have you here. Please feel free to send your questions, post them on the Q&A side so that we can get to your questions in the next 10 minutes. Thank you. Inyobong, Amit talked about the fact that we have this youthful population. We need to start thinking quite strategically about what we're doing for the population. You know, we can't keep talking about this demographic dividend in Africa and not actually, you know, trying to realize its potential. But one of the things that's of particular interest to me is early childhood development and the fact that, you know, a lot of key outcomes are determined in the very early ages of a child's life in terms of their access to healthcare, but also nutrition and water. And from your perspective, Inyobong, I'd be quite interested. What role do you think things such as telemedicine, telehealth, and other tech-enabled solutions can play in supporting children, particularly in the early phases of their development on the continent?
Thank you very much, Simiso. Basically, as we know, the major goal of early child development is to provide young children with their cognitive, emotional, and social development needs, providing them good health, adequate nutrition, security, and safety in preparation for them to begin their primary education. This is well described in the Sustainable Development Goal Target 4.2, where it's talked about by 2030, we want to ensure that all girls and boys have access to quality early childhood development, K, and pre-primary education so that they are ready for primary education. So like we know, of course, education is very, very important. When we're talking about the high population of the children and women that we now have, the demographics that we have in Africa, it's very important that we give these children education so that they will grow up to have a means of livelihood and contribute to the economy. So basically, there are a couple of child survival strategies that have been set aside by UNICEF, WHO, and a couple of international development partners to sustain these children, you know, towards getting the best of education and livelihood for them. So, and telehealth can play a very critical role in that regard. right from providing an opportunity for clinical services to be delivered remotely by specialists to these children in terms of for growth monitoring, the wait for age chart. We have some digital tools that can provide that growth chart now that enables physicians to be able to see if these children have the right nutrition, if they are stunted, if they are wasted, or if they have some acute malnutrition disorders. And then we also have a couple of other things like the breastfeeding, family planning, female education, food fortification. We have health education videos, and counseling for mothers on breastfeeding techniques and food demonstration on nutritious food and how to make homegrown nutritious food. This can be done through several form of clinician to patient telehealth, approaches. And then, of course, for immunization, we have the immunization reminders, where you can have mobile apps and even wearable devices that can prompt mothers on the routine immunization dates. So this can be explored to improve the uptake of immunization services across the health sector. And also, most importantly, the issue of provider training, health workers at the lower level, like the primary health center. You can also have telehealth services for e-learning, and then that allows specialists to kind of transfer some level of skills to lower cadre, health workers, so that they're able to provide these basic child survival strategies at the community level. So it's quite broad, and basically looking at improving the quality of care, and then making healthcare affordable by not allowing these children, particularly those in the rural areas, to travel long distance, to access healthcare. Telehealth tools can help us to break that physical barrier, and as well as the financial barrier that is impinging on the health sector at the moment.
Fantastic. And I think to your point about, it plays a crucial role in solving some of the core problems which we already know, and it really looks to unlock solutions. Simba, when you started your company, you obviously had a certain idea about the addressable market and how you were looking to approach it. I'm curious, has that changed over time as you've collected more data and looked at what the opportunities are? Because I'm sure when you started your company, you thought there's a clear opportunity here and I'm going for it. Have new opportunities come up as you've obtained data throughout your years, and how has that changed some of the services or your approach to delivering your services?
Thank you. It's the same. I mean, you start a company and you think you know the market really well, and you think you've studied the segments and what they need and what they're willing to pay for. I think one of the most surprising things for us was we thought, the retail market, the average individual, recognized how important healthcare is, and that they want a health insurance plan. They want some kind of coverage. They just haven't been given it. We were the first to introduce health plans for individuals and families to buy, in 2015 after we launched. But, it seemed people on the average would rather just spend their money on something else. And that habit to pay out of pocket whenever they needed to access healthcare was something we had to work very hard to we had to bring up that consciousness in them, because it simply didn't exist. So the market we thought we had in our mind was large, but it wasn't so large. Another thing we also discovered was that, the disposable income that we thought this market segment had was a lot lower than our initial thoughts. But over time, though, we've discovered there are other opportunities. that sometimes, coming in from the angle of preventive health is a way to break into people's mind and let them realize that their health is something that they need to invest in and they need to be proactive about. Something else that we noticed that people are very keen to spend money on when it comes to healthcare, and then it helps us to catch their attention, is reproductive and sexual health, as well as mental health.
Really, mental health is getting that much attention?
In the past few years has started to gain more and more attention in the minds of our consumers. Well, are they consumers really? But in the mind of our market. Prior to the time when we started, and the early years when we started, there was very, very little interest in mental health and how much of a cover our health insurance plans provided for mental health services. But now it is a point at which we can always start a conversation and discover that people are willing to engage with us, and people are willing to actually invest in some proactive way to look after themselves. What else did we discover through data? Non-communicable diseases is huge. And that's why we spend so much time and effort on preventive healthcare, education, also on working with people in the tech world to develop apps that can help them monitor their health indices better. I mean, these are some of the things that data showed us to be different from what we perceived it to be. There's a lot of literature around how in sub-Saharan Africa the healthcare challenges are moving from communicable to non-communicable, but until you start, you never really realize how significant that trend is, and how much younger and younger population are falling prey to this kind of conditions. They only used to be prevalent in the older people. So, and the data speaks for itself, you see. When we share this data with prospective enrollees, enrolled members that we're talking to consider taking a health plan, it does make a difference. I mean, sometimes that's what unlocks the door of their mind to the possibility that, maybe I should take a health plan after all.
Yeah, absolutely. Everyone get one. If you don't have one, get one. So moving on to the Q&A, some of the formal questions. I'm just going to go through them and address them to the panel. Starting with a question from Osa, and I'm going to address this to Amit. The question is, the percentage of health to GDP is still very low in some African countries. What deliberate efforts can governments in partnership with the private sector take to drive this northwards?
Yeah, that's a tough question. You had the numbers earlier about $1,600 and $43,000. The whole economy is small, so the health GDP will remain small. What can the private sector and others do is to attract investments and more money into health. When we have a total health expenditure that actually looks after its citizen, it's fine. It's not the role of the government to provide a complete overarching health expense for its citizen. In Africa, the formula is absolutely clear. It's going to be both public and private. There is no way we're going to make it an NHS system. That's not going to work. In Africa, it's a mixed model for the health of our people. So what can private sector do? Private sector can get greater investments in healthcare, try and look after the population who have the means, ensure that the manufacturing and factories around the healthcare space start improving, try and make all the medications that we can, manufacturing sites that we're talking about, and then also align the donor money so that the donor money is appropriately used and not misused. And when we can use the donor money for what the African countries need and not what is dictated by the donor community, I think these three levers is then going to produce more amount of health on the continent, and we'll probably see better GDPs.
Fantastic. Thank you. Thank you. Here from Lauren, and her question, or Lauren's question is, how can we collaborate with e-commerce giants in distributing health products or services?
Well, I think that's a great one, because these e-commerce companies have built logistics networks that will take years for anyone to replicate and try to rebuild. And I think if we consider a health commodity like any other commodity that is, delivered at home, then I don't see any reason why, if my pizza can be delivered at my home, at my doorstep, I can't get my insulin, for example, also delivered in the same way. There is this whole paradigm of a healthcare system that is centered around health facilities. That has been the paradigm all this time. And recently, the most advanced systems have empowered the community health workers to really try to be closer to the community. But today, given the penetration of mobile phones and mobile technology, I think we need to imagine a future where the individual becomes the last mile. So when you think about delivering a service, don't think about limiting the delivery point to the nearest healthcare center point or nearest facility. Think about, how can I deliver this service right to the person, to the individual? So delivery is one thing, and we can talk about so many other things. But again, coming back to the drone, and Amit was talking about how it has been difficult in some countries even get started. In more countries, in my country, for example, we are even talking about household delivery by drone. So you can order your medication, your doctor can refill, can give you a prescription on your mobile phone, and the text goes to the pharmacy, and the pharmacy ships the product to or even the drone company has a stock, and then the next thing is a whiz on top of your doorstep, and then a product in 10 minutes is dropped. This was tried and proven to work for patients who had medication for cancer and medication for diabetes in Rwanda during COVID, and it can actually be scaled up. So e-commerce delivery, instant logistics company, I think there are so many ways we can think about improving the delivery systems for medication. But again, it's a whole system. I'm not just in favor of optimizing the medication delivery. I'm in favor of doing everything in tandem, including what Simbo said around preventative care. This really goes in line with all of that. But yes, e-commerce. One thing that I would like to close the point on is many sectors are moving fast. I mean, the financial sector moves so fast. We've got M-Pesa example, and how it triggered an entire revolution around financial inclusion. And there are now more than 500 mobile money solutions across the continent of Africa. You realize that the public health and healthcare sector has been moving quite slow in embracing innovation. That one we need to look it squarely in the face. During this COVID time, telemedicine in US and Europe increased by 4,000%. 4,000%. So that's 40 times increase in telemedicine services. In Africa, only 300%, 3 times increase. Why? Regulatory frameworks, systems that cannot integrate, interoperability of systems, and so on and so forth. Question about data security, confidentiality, privacy, and so on and so forth. And really like the maturity of the healthcare ecosystem itself. But I think we should all collectively put our minds around how do we accelerate the adoption of more technology inputs by public health delivery systems in Africa, because let's face it, even if we know that digitization is the way to go, and it grew by 300%, but the room for growth is huge, and we shouldn't be contented by the modest 3 times increase of telemedicine, for example, and this cuts across other areas of healthcare delivery and public health systems.
Absolutely. I'm going to try and get through 2 or 3 more questions because we have about 6 minutes left. Picking up, you mentioned telemedicine, Phil, in your intervention. We have a question here about telemedicine, which I'd like to put forward to Simbo and Inyobo. And the question is, how can telemedicine drive forward mental health reforms for African healthcare systems? So how can telemedicine drive forward healthcare reforms, mental healthcare reforms?
Oh, excellent. I mean, this is a natural point of intersection. The way people access mental health services is also important. People tend to want a lot of privacy, much more privacy indeed, than when they're accessing other types of healthcare services. And, telemedicine provides an avenue for that to happen. People don't want to be seen going into the practice of, psychiatrists. They don't want to be seen anywhere near a therapist's office. I mean, it's kind of cultural for most of us in Africa. And telemedicine is just ideal to take away all those, apprehensions, because you can then dial in and have your sessions from the privacy of your room or your home, via a telemedicine platform. Indeed, many of the sessions that we did that gave us the insights we got happened in the middle of the COVID-19 pandemic. During that lockdown period, a way in which we were able to connect with a lot of our enrolled members was having webinars that were hosted by psychiatrists, psychologists, etc., because we knew the kind of impact that was having on everybody. I mean, even me personally, as well as my staff, I knew how we all felt. And it was surprising how many people would reach out privately to say, look, our health plan does cover this, doesn't it? And we say, yes, it does, of course. Okay, I'd like to talk to somebody, So I think it's a natural, it's just a natural, seamless, relationship, and one that needs to be explored further and better optimized, quite frankly.
Right.
Okay. Yeah, thank you very much. I think Simbo has dealt quite a good deal with issue of stigmatization and privacy concerns when it comes to mental health. So I will just talk about the access, to mental health care services. If in Nigeria, I don't want to be quoted, but I don't think we have up to 500 psychiatrists in Nigeria. All right. I know that a few years ago we had roughly about 100 to 200, maybe 10 years ago, but now I'm not sure it's more than 500. And then you're looking at the magnitude of mental health challenges in the country and even in the continent. When you look at the spectrum of mental health disorders, you see that quite a huge burden of mental health problems is what we are facing now. All right. And therefore, we don't have enough mental health providers when you compare to the population of Nigeria, for instance. So with using telehealth and telemedicine tools, you are able to, for instance, provide some basic mental health screening tools like the GAT7 tools, like some of the work we have done during the COVID-19, in the COVID-19 call center. We have been able to integrate the GAT7 tool, which is just for a screening tool for mental health disorders. And then by using telemedicine to give other general practitioners the access to use those tools, and then providing them with a set of algorithms, and for them to respond to some of the mental health problems that we're getting from the population. By doing that, we're able to increase the access to mental health services, and this is something that you cannot achieve with just doing the traditional, method of assessing healthcare. So telehealth tools can give you that leverage beyond just the privacy of the discussion. It also makes every opportunity of seeing a physician for individuals to be able to access mental health services.
Thank you. So we're coming to the end of our session. And I still had several questions that I had to ask, or not had to, wanted to ask our fantastic panel. But I'm obviously in service of you, the audience. And so to wrap up, I'm going to pick and combine two of the several remaining questions and put them forward to the panelists as for their final remarks. And the question is, what role can young people and people in the diaspora play in supporting the development of Africa's digital healthcare sector? So starting with Phil.
Well, I think it's almost self-evident. We need more young people to be involved in innovation and entrepreneurship around health. There are so many problems at the community level that only eyes and ears on the ground can see and can solve for. And I can tell you that for almost every problem in a local community anywhere in Africa, if you solve for that, there'll be 1,000 communities around the continent that have the same problem. And then young people working in tandem with the government and also investors to invest into scaling those solutions can go a long way, getting them excited, knowing more and innovating and producing solutions that this continent needs. So definitely young people is an issue that I've very much enjoyed when I was Minister of Youth and Technology, and I've seen so many young people coming from different sectors and innovating around issues like sexual and reproductive health, for example. There are issues we can make history if we really engage our young people who are digital natives today around public health systems improvement. Thank you.
Fantastic. Simba, over to you. The youth in the diaspora, what can they do to help?
I'm going to have to also kind of lean in the same direction to say that there is such a huge opportunity in the healthcare sector in Africa right now, especially at that intersection between technology and the digital world and healthcare space. And funding will not be a problem. I mean, there are quite a number of entrepreneurs that have been able to raise significant funding for their enterprises. We have I think it's called 45 Gene. I saw
Yes,
an ad from them
54.
recently.
I think it's 54 Gene.
Yeah, there's also Helium, there's Doctora as well. There are quite a number of African startups in health tech now that are raising international funding to support the growth of their business ideas and to scale up considerably. In fact, it's attracting much more funding, almost second only to health to fintech.
Yeah.
So a word of encouragement, if there's any innovator out there who wants to make a difference in Africa and wants to build a legacy and also high returns on investment, you can do both. You can have the financial reward and you can also have that social impact. I think health tech is the way to go.
Fantastic. Inyabo?
Yeah, I think funding is very important, but to me, the foundation is capacity building, for digital health. I think Phil and Amit talked a lot about it. And at this maturity level where we are now, it's very important that we build the capacity for the critical sets, the skill sets required for digital health implementation in Africa, because lack of capacity has been proven to be responsible to resistance to change in adopting new technologies and new cultures in the health sector. So what I think is a lot of Africans in diaspora can begin to build capacity of the health workers in terms of for digital health, for the critical skill set required, health information technology professionals, data protection officers, and so on and so forth. And luckily for us, we can also use digital technology to achieve that. So once we have that done, and then it's really going to improve the adoption and acceptance to digital health in the health sector. That is my take. Thank you.
Thank you. Amit, you have the final word.
I think the youth and the diaspora have two different functions as their primary functions in changing digital health in Africa. For the youth, I wish we can create a culture when smart children at secondary school, when they're asked a question, what do you want to be when you grow up? These days, when you ask them that, you'll hear neurosurgeon, you might hear other things. But I hope we get...
Which children are these? I'm thinking maybe influencer, YouTube star, I don't know.
Yeah, I know. There's so many kids who say, I would love to hear what the kids on the African continent want to be when they are interviewed, what they'd like to be, especially the ones who've done very well in school. But I hope sooner, in 3 to 5 years, the culture of, I want to be a digital health expert starts becoming heard across the corners of this continent. And when the youth start becoming implementers, and the uptake of digital health technology would be, the innovations will accelerate if we get the youth involved and they see impact being made, and they make Africa live longer. Our life expectancy starts changing. And for the diaspora, I think the whole idea of promoting innovations and partnership, because they live in countries which many of us who live in Africa don't have a chance to engage with some amazing partners and amazing resources. I see diaspora as a conduit to bringing innovations and investments in creating a bigger explosion of movement of digital health in Africa. So I see two different things between the youth and diaspora. Thank you.
Thank you so much. Thank you. We're a little over time, but it was absolutely worth it. This was a fascinating discussion. I'd like to thank the conference organizers for the LSE Africa Summit for bringing us all together today. Thank you to the panelists for their interventions, their thoughts, and generosity of spirit. And to everyone who tuned in, asked questions, and engaged. This discussion was only possible thanks to you and your participation. So thank you very much. Enjoy the networking and the rest of the summit.